Joining us now to discuss is board-certified oral and maxillofacial surgeon Dr. Mark Stein. Dr. Stein, welcome to Bloom.
Thank you so much for having me. It's a pleasure to be here with you today.
So, Dr. Stein, there are so many reports showing how closely oral health is linked to our overall health, yet many people ignore problems with their teeth and gums. You're an expert in your field. What links to severe diseases have been found?
So, in recent years, multiple studies have come out linking the effects of high levels of bacteria in your mouth, or what's called periodontal disease, to several other systemic diseases, such as cardiovascular disease or heart disease, endocarditis, or an inflammation of the lining of the heart, possibly pregnancy and decreased birth weights, pneumonia, and just an overall lowering of your immune system so that you're less able to fight off other infections.
What issues do you see most often among the new patients that come to you, and how do you treat them?
So as an oral and maxillofacial surgeon, we kind of see the end results of neglected oral care or advanced periodontal or gum disease. Patients often present with either an infection or an abscess somewhere in their mouth, a broken tooth, a swelling of the jaws, loose teeth, or teeth that have been missing for years and now require replacement with dental implants, which are the standard of care in today's world to replace missing teeth.
And, I've been one of them in the past. I don't do this anymore, but I did avoid dental work out of fear, and that it could be painful and you wait, but that's really not the right thing to do. If you get in early to see your dentist or your specialist like yourself, you can address these problems before they become a real issue.
You're absolutely right. The key to preventing furthering of the disease is early intervention and early prevention. The sooner a problem is diagnosed and the sooner it can be treated, the much better the outcome. The good news is that when patients come to see someone like myself, most of the procedures we do are done in a very comfortable way under sedation or twilight anesthesia, where the patient is sleepy during the procedure, they're relaxed, they're very comfortable, and when everything is completed, they wake up comfortable and painless. So we often see many patients with issues with anxiety or challenging ways to get to the dentist because they're fearful of how uncomfortable it might be, someone working in your mouth. But patients should know that in today's world, if you're going to be seeing a board-certified oral maxillofacial surgeon, we can do all procedures under the comfort of sedation, which is a twilight sleep. It's a very safe way to administer anesthesia. The patient is fully monitored during this procedure to make sure that their health is safe. And the beauty is you wake up and it's complete and you're comfortable.
Yeah, that's awesome. And what distinguishes you and your practice from others in your field of work?
So, as a dual degree oral maxillofacial surgeon, I went above and beyond the regular training program and then completed medical school training as well as a residency in general surgery. So I'm specially trained to deal with more complicated situations, patients with a more complicated medical history who may present with complex medical problems, which should make patients feel that they're seeing someone who not only can deal with their oral issues, but also in combination with other systemic problems that they might have. And over the years, I've developed a practice where other oral maxillofacial surgeons refer more complicated cases to me, cases that are not in the realm of someone without extensive experience.
Dr. Stein, what a pleasure it's been to talk to you. Thank you so much for joining us on Bloom today.
Thank you so much for having me today. This was great.
Absolutely.